CCAR is an organization run by and for people in recovery. And what we're finding is that the people in recovery are no different than the general population. Take away the stigma, and you have the creativity, you have the risk takers, and you have the valuable people contributing to our community. I know that CCAR, the way they're moving right now, is going to continue to grow and develop.
I remember getting a call from a friend saying this organization was starting in Connecticut called the Connecticut Community for Addiction Recovery. And I went to 2 of the organizing meetings after I had put in my resume and cover letter. And Bob Savage was running the meeting over at Merritt Hall at Connecticut Valley Hospital. You were there, Friends of Recovery Norwalk, and I was like immediately impressed with you. And I had applied for the associate director position with Bob Savage, and I was really impressed not only with you, but with the meeting and what they were talking about. I never heard of recovery being out in the open like that there would be such a thing as a recovery advocacy organization. And Bob sat with me and he chatted with me, and ultimately I ended up being the first hire. And I started back in January of 1999, and here we are 20 plus years later, and amazed at the growth and what we've accomplished. How did you first hear about CCAR?
I felt really excited about Bob coming to one of our local Friends of Recovery meetings, and really it made a statement that there was an organization that was looking at the bigger picture than where we were at. And one of the things that I really appreciated was his honesty.
When I first got involved with this now about 5 years ago, I really didn't think it was really possible that the recovering community would be willing to be organized to come together and put a positive face and a voice in recovery. I thought I would take and attempt it for about 6 months and I could go back and enjoy my retirement. What I found, though, is one of the most unique and the most powerful community that we could possibly find in the recovering community itself. You look around you today, and we have women, we have men, we have Latinos, we have Afro-Americans, we have all different people representing all different parts of our society. It's really one of the most powerful experiments that I've ever participated in, because under the umbrella of recovery, we're able to bring all these different people together, and the glue that brings everybody together is the respect for recovery and the respect for what the individuals who are in recovery, what they're doing. And under that, we are able to really learn to really support each other, and also to really recognize and to value each of us.
I went to that second Tuesday night journal membership meeting that CCAR would hold monthly, and I quickly got excited about the bigger picture. And so I really started to believe that, my voice had power back then. I didn't even realize it. Even the anonymity to advocate was like a question mark, because I came out of the 12-step fellowship. But I knew I was doing the right thing for the right reason. And the thing about that meeting was it propelled my recovery, but it also instilled in me a purpose that I too could be a voice for the voiceless. Outside of what I was really doing at the local level, but I could be that voice at a state level and a national level.
That's what Bob said too. He was organizing because he worked at the Department of Mental Health and Addiction Services for 30 plus years. And he said he was always making decisions about people in recovery, and they were never at the table. And after he retired, he wanted to get people in recovery at the table.
So I first heard about CCAR from one of my best friends. Her father served on the board. May he rest in peace. And he made me aware that there was a job opening at CCAR. And I've never heard of CCAR. I couldn't even pronounce CCAR whenever it started. I didn't even know what it meant. And in coming in, Bob Savage hired me. And when I first started, there was only 7 people. We had like one office space that we shared with another organization. And right away, I felt so welcome. And in learning about recovery, because I knew a lot about addiction due to my family members being addicted, but I didn't know anything about recovery. So just learning about recovery and knowing that there's hope, and CCAR is the organization where we inspire hope, we care for people, we make those connections, is one of the reasons that I'm still here today. But just seeing the organization grow from 7 staff members, no recovery community centers. They were more like chapter meetings back then, and organizing the recovery community, like you mentioned earlier, to make sure that their voices are heard, to now having multiple centers and programming, and just keep expanding that, and staff growth as well. It's all about helping people in recovery.
I think we were positioned early on with a lot of the specific training that was needed to do advocacy. And there were some great trainers that really developed curriculum, including being able to be trained to, educate, policy. We started fundraising, educating the community about addiction recovery. And one of the purposes was to really get people to come to CCAR to learn more about, like you said, the recovery movement, and understand what your role was. And I was really glad to have had that opportunity to get training, because there was a lot of things that I wasn't aware of until I got into the recovery movement that I needed to know to be an advocate. And so that's where I really appreciated, people like Jim Wolfing and Art Woodard back in the day helping support us with training.
The early days were all about putting a face on recovery, simply put. So we weren't providing any recovery support services then, except what people benefited by putting their face on recovery, by stepping out and telling their story at the legislature or at statewide policy meetings. So we trained people to put their face on recovery. We no longer hid behind the veil of anonymity, that we wanted to be public about our recoveries, offer ourselves as living proof that recovery is real.
My name is Phil Valentine. I'm a person in recovery from the disease of addiction. I was a severe alcoholic and cocaine addict, and now I prefer to say that I'm a person in recovery. And only for the grace of God, I've been sober since December 28th, 1987.
Advocates for recovery want to talk about saving lives, and I believe it's much more than saving lives. It's about redeeming lives, that people go from being a drain on society to being a contributing citizen. And that's really what all our organizing efforts were about in the early years.
That time frame was where we were starting to have a recovery movement that was created by advocacy. And at the legislative level, state officials were getting to see for the first time and hear for the first time the recovery story.
I'm here today to share with you my thoughts on the issues of persons in recovery having felony charges on their record and still being a hindrance in their lives. For 17 years, the disease of addiction had me virtually victimize everyone I came into contact with, including myself. It dragged me through many prisons, countless jails and institutions, homelessness, and plenty of misery and suffering since 1976. At times, I lived in abandoned buildings and cars, not only in Connecticut, but in other sites in the nation. I was diagnosed in 1988 with HIV because of my drug using and virtually had given up on life. The next year, I received a 5-year prison term, and in spite of my situation, a ray of hope came as I saw the need for a change in my life. And I then began my recovery, and in 1992, I became employable, a father figure, and for the first time, a community leader.
Drug addiction has brought me to some very low places in my life. Not only have I gone to prison on a felony conviction, but worse. I lost custody of my 3 children for over 4 years without even so much as a visit. This was the hardest thing I have ever had to face in my life. Well, I'm here today to tell you that we do recover. I got sober on January 13th, 1999.
I discovered that persons experienced in substance use often have important insights into the power of recovery and can make inspiring leaders in the recovery movement.
One of the purposes was to make them aware that we were tax-paying citizens, that we made a difference, and they needed to invest in the recovering community because we were investing in our community. And I think that made them recognize the value that we brought to the table, that, like you shared, how could you decide for us what's best for us without us?
I remember when we were going to first open the Willimantic Recovery Community Center back in 2004. That was a big deal. It's never been done before. It was unheard of. What is a recovery community center? We had to start it up, you know. The community got involved. We opened a center in Willimantic, and it was very pivotal because Willimantic was known as heroin town. And it had this very, very bad press. Turning that perception to recovery town and opening the center. And it just goes to show you that, again, recovery is possible. Just turning that people's perception is no longer heroin town, it's recovery town. And we are here and we are out and we're open about our recovery to show you that it's possible. So the recovery community centers ideally should be located either on a main street, somewhere that's very visible, in the heart of the community, on a bus line, so it's easy to access. The most important thing, obviously, is that we're visible, that the community can find us, and where we need to be. So, I don't want to say it's areas where there's drug dealings or prostitution going on or whatever, but that does not deter us from opening a center in one of those areas. Right. We're known in the community as the recovery place. They respect us. They may not be ready to get the services or the support that they need, but they know that we're there, and they know where they need to go when they're ready.
People should recognize the value of what a recovery community center brings to not only the community, but the recovering community. It allowed people to have a place of safety and empowering people to become able to connect to services and supports that was never, ever in their community. And I think at the center, people started recognizing the value of being a mentor or a guide. Because we had people coming in right off the battlefield, coming in saying, hey, I want to get in a detox. I want to get in recovery. I want to stay clean. I've only been clean for a week. I got out of detox. I don't know where to go, but I know this is a safe place. And then we had people that were volunteering, giving back, which is a real beautiful theme that we have. And people recognize the value of wanting to give back in certain ways. And I think one of the things was giving people hope that they too could give back. And the unique opportunity was, I can help you get to where I'm at. And being transformed was really the opportunity to see other people get transformed by your transformation.
We started to call ourselves a recovery community organization, and we didn't really have a definition for that. And in many of my meetings at the national level, because we were still receiving federal funding, I had the opportunity to discuss that very question with Pat Taylor and Bill White, and we ended up writing a paper defining a recovery community organization. And simply put, it's by and for people in recovery that focuses on things like advocacy, providing recovery support services, education, training, and awareness. And that's what we modeled a recovery community organization to be. That's where telephone recovery support evolved. That we would call somebody once a week to check in on their recovery.
I've been volunteering down here at CCAR since 2008. They gave me a training, telephone recovery support. I've been calling, and I do the outreach, and I've been helping people. Little did I know, it's been helping me, You know, I've been down here now almost 12 years. You know, I have 11 years, 7 months, and 21 days clean. Little did I know that the center keep me away from people, places, and things, and it helped me put a face on my recovery.
And so in those early years when the volunteers were very active, they wanted more training, right? Absolutely. And so we started to say, well, what kind of training is it that you need? And they say, well, when people come in, we don't always know how to work with them because they're coming from a variety of backgrounds, or they may not even be really looking for recovery, maybe just a warm place to sit and a hot cup of coffee. And that's where the Recovery Coach Academy was birthed, because they wanted the skills to be better able to communicate with someone, coach someone in their recovery or into recovery. The CCAR Recovery Coach Academy has blossomed into more than I ever expected. Many, many years ago, I had this vision of a wave actually coming in towards shore, and it was such a big wave that it was that classic, the water recedes from the shoreline as the wave builds momentum. And I knew in my spirit that that wave was recovery coaching. And so I brought it to the staff, to the board, talked about it, and we all agreed that we ought to position ourselves to train recovery coaches. And the basics are so simple. I like to say they're radically ancient, that we just teach people to listen, ask good questions, discover your own stuff and learn how to manage that so it doesn't get in the way of the conversation. Treating people as the best resource on their own lives, not treating them like an object. I'm not going to tell you what to do and expect you to do it. I'm just going to ask you the two most powerful questions. How can I help you with your recovery today? And what does recovery look like for you? I'm amazed at the growth of this CCAR Recovery Coach Academy. The first pilot was run in 2008, and since then, at this time, we've trained more than 45,000 people across the United States and some in other countries. I mean, I even had the opportunity to go to Canada and Vietnam to train the Recovery Coach Academy, and I think it's just starting. Those basic concepts resonate with people all over. And whether you actually go on to coach anyone is not the end goal. It's really about improving your own communication skills.
It's interesting because when the recovery coaching program first started, obviously it was a startup. It's never been done before. Okay. We had to figure it out. So we hired, I think our first hires were 4 coaches at first. So with the help of those 4 coaches, the manager, and the rest of the coworkers, we developed a model for how that should look.
So in the emergency department, we often have few resources to take care of a lot of needs. So this was one more resource that was available for us. So recovery coaches came in, they spent the time with the patients and found a solution and tried to break a cycle of people coming in and leaving and coming back and leaving, and then ultimately ended up with severe medical problems or even worse, in death. And so it really seems like there's a solution, and for patients to relate to someone that's been down the same steps that they've been down.
The idea of treating someone as a resource instead of an object is something that we at CCAR really stand behind. And it's something that could have helped me in my recovery when I was trying to get into recovery. I felt that I'd been objectified in many different treatment facilities and situations I'd been in when I was trying to work a program in recovery. And being treated more like a resource is something I feel like I could have benefited from. And that's a lesson that I took from the RCA. Any time where someone has long-term success is one of those things that makes me happy to have the job that I have and proud to be an EDRC.
Early on, as I was trying to explore the best ways to support people in recovery, I heard about the just vital nature of peer supports. People who are in recovery want to be able to work through recovery with people who've experienced what they've experienced. And what CCAR does is build a capacity whereby early on in your decision to get into recovery, you can talk to people who have been through recovery, who have battled addiction. And so as soon as we all started talking about how to take on the opioid epidemic in and around Connecticut, I quickly discovered that CCAR had some capacities here that almost nobody else had. That magic moment for individuals is when they have had a near-death experience where they've overdosed, where they're in the hospital. And it's at that moment that a lot of people do make the decision to start living their life differently and start seeking help. And by having a recovery coach right there in the emergency room, standing next to you as you're going through that life-changing moment, it sometimes makes the difference between a recovery path and a path back into addiction. And so I've talked to these recovery coaches. I've seen them in action. I've visited them at emergency rooms and at hospitals. And I'm just convinced that this is one of the models that's going to push us on a path out of this crisis.
I think that's what one of the miracles and almost spiritual nature of the work we do is that we start something and then it builds, and if it's the right thing to do, it gains momentum. So now we're up to 20 emergency department recovery coaches, and in this last group of people we hired, which is even the most remarkable thing to me, is that 2 of the coaches we hired were seen in the emergency departments by CCAR emergency department recovery coaches. So you follow what I'm saying?
Yes.
That the people they went to see got well, pursued their own recovery, took training, got involved with volunteerism, worked at our centers, applied for the position, went through that rigorous interview process, and are now hired as emergency department recovery coaches. We have developed an entire career ladder, if you will, from being down and out in the emergency department to now being in a position to go and help those coming behind. I can't think of anything more remarkable or rewarding in my tenure here than to see that happen. Another thing I look at, considering the growth, is you walk into our multi-purpose room in our administrative offices, and the first thing you see on the wall are 20 framed t-shirts from our Recovery Walks events. And I remember the very first one in 2000, where Bob Savage tasked me with the chore of organizing this first ever Walk for Recovery. And he said one of the most remarkable things to me, most encouraging things, he said, "Phil, do you think you can get 50 people to walk?" I said, "Yeah, of course I could do that. Yeah." He goes, "If you do, then it's been a success because it's never been done before." And we ended up with 700 people that very first year, and it's grown ever since.
Welcome to this first Recovery Walks event. I think we should all applaud each other for making it on a beautiful Sunday. I'm Bob Savage. I'm the project director of the Connecticut Community for Addiction Recovery, CCAR. That's hosting this event. Our vision statement is that society sees treatment and recovery as a positive and heroic effort by the year 2005. An event such as this makes it possible.
If you look at our walk, the unique part is that we have an opportunity to share on stage personal stories of recovery in a celebration mode. And never before do we have family members and friends and allies supporting an event that we put on and know that this is recognized nationally. Our walk is recognized nationally, that they can see the benefit putting a face and a voice to recovery.
We started very small, and we're approaching 50 staff people. Our budget was relatively small, and now we're a multi-million-dollar organization. And I think any recovery community organization, any statewide recovery community organization, is definitely a multi-million-dollar organization. With that money and being good stewards of that funding, we can help thousands and thousands and thousands of people maintain and sustain recovery, turn them from being drains on our society to contributing citizens. People often ask me about the sustainability of CCAR, and I talk about conducting ourselves right. And I think we have conducted ourselves right over many years. RIGHT is an acronym for respect, integrity, gratitude, honesty, and transparency. And those are all recovery principles. So it's up to us as leaders, we've been here many years, to make sure our whole organizational culture embraces those principles, and we have to model that. When we conduct ourselves right, resources will follow. I know that's not the classic sustainability plan, but I see it working, and it's worked for 20 plus years.
The main thing that I've seen is the organizational culture creating this positive culture and maintaining it, and knowing that it's going to shift the more people come on board, but just knowing that it's going to shift and being present and able to shift along with it, and just being aware, I think, is important, because we're always having those conversations, whether it's at staff meetings or as a leadership team, of how is the culture going to shift? How do we maintain the organizational culture so it can continue in a positive note moving forward? So I think that's one of the important things that I've seen throughout the years, is having those conversations and being aware and putting our work into making sure that the culture remains intact, no matter how big we continue to get.
What CCAR did was, I think, in terms of innovations that were so important to the larger movement, was they developed a model for financial sustainability and stability. When I think of the core strategies of the larger movement, CCAR was a pioneer in recovery celebration events, some of the earliest recovery marches, the recovery community centers. CCAR was one of the first organizations that said, what would it be like if we sort of elevated the way we tell our story to begin to use technology to help do that? Lots of people need to be extremely grateful for the innovations that CCAR has pioneered.
When I look for what is it we're to do next, my focus will go to CCAR, because they're the ones who set the footprint in the snow. I think that this social movement is going to change the world.
There's a whole bunch of people in this room that didn't choose recovery. Recovery came and got them, right? Recovery was something that snuck up on them. They thought they were doing another hustle. They thought they were getting people off their ass. They didn't know their ass was transforming in the process. Recovery is contagious simply means that recovery can be socially transmitted even to people who are not initially receptive to it.
We have come 20 years in our evolution. What do you think is in store for us?
Well, I believe we'll still continue to grow. I do see a lot more initiatives happening at CCAR. I think we're going to be doing a lot more collaborating and partnerships with major companies. I think the impact we're going to make in the recovery movement is being asked to provide CCAR in other states. And I think our multiple pathways of recovery conference is going to spread. I think we're going to be a leader internationally, if we're not already, in showing that there's resilience in having conferences around the world.
The future, I see growth, but with multiple pathways, I see multiple pathways being more accepted throughout and people being more open to it. That's what I see.
We promote recovery first, way before CCAR, way before any individuals. We're about promoting the concept of recovery and all the benefits of recovery first. People that are in recovery now are seen in a different light, that they have a more accurate representation, that they were really sick and took incredible steps to become a person that contributes to their community. And I would say most people in long-term recovery, that's true, and that's the goal. So over 20 years of being here, I've seen the perception of us, the recovery community, shift for the better. The other thing that I've seen, and I think it's hard to put into any words, but the numbers bear out that when you've seen more than 5,000 people in the emergency departments, when we've had tens of thousands of people come into our recovery community center, thousands of people called in telephone recovery support, thousands of people contributing through volunteerism in recovery-related activities. Those are lives that have been improved by these little imperceptible measures that when you put them all together, the impact is extraordinary. And honestly, I'm moved to tears. I'm humbled by having a small role in a force that was able to create that wellness and health in so many people.